This podcast episode was recorded live at the 2022 Asco Annual Meeting in Chicago by Oncology Data Advisor and Convey Med.
Hello, I'm Beth Heller, and I'm here today with Oncology Data Advisor at Asco 2020, and I'd like to introduce...
I'm Stephanie Van Winkle, and I'm Executive Director of Oncology State Societies at the Association for Community Cancer Centers.
And so what are you doing here at Asco?
At Asco. So my organization manages 21 of the state oncology societies across the country, and we are part of the state affiliate program of Asco. So if you walk into the exhibit hall, Asco has a state affiliate booth at the front of the exhibit hall, and they invite all of the state affiliates to represent themselves at the Asco state affiliate booth.
And how many states do you have representing themselves here at Asco this year?
So I know we have our 21 states being represented, and there are also executive directors, I think from probably about 6 or 7 other states that are here. So all told, we have close to 30 of the state societies represented.
And what do the state societies do at the Asco annual meeting?
So most of the state societies, it depends on the state society. I'll give you one example. Wisconsin is one of the states that we work with, and they actually hosted a reception last night because Wisconsin has so many Asco attendees. So you'll see activities like that happen. We also have Iowa. The Iowa Oncology Society had a poster presentation talking about a project they did on genetic counseling. So it just depends on how many members of the state society are here. But we try to meet with as many of our board presidents and members while we're here as we can. So we invite them to come to our booth.
Great. And what do you guys do to help your board presidents?
So we do a variety of things. We have a program that we just launched a couple of years ago called Leaders in Oncology. And that is really to help equip our board leaders to be leaders of an oncology society and look at different aspects of membership development and membership engagement. We also do a lot of work to really help empower our state societies around legislative advocacy work. So we just work with them in a variety of areas. And we also have worked with our boards to really look at how they can truly represent cancer care within their state. So many of our boards not only include ASCO members, but we have ONS members and members from other organizations like AOSW on many of our state society boards.
So what do you think are the biggest issues for the boards to address this year in cancer?
Yeah, I think one of the most pressing issues for our boards are really some of the access issues related to prior authorization, some of the regulations that they're really being hit with around, step therapy, the administrative burden for them as practitioners, and also the freedom to practice the type of medicine they want to practice and make the clinical decisions. It is becoming more and more difficult, really, in many of our states. So that has come front and center as an issue that our states want to address and really have their voice be heard, both from legislatively and also with payers, around some of the implications of some of these regulations to them as clinicians.
No, I've been hearing a lot in the different sessions about people are asking, this is great, we now see this clinical trial data, but will I actually be able to give this to my patients? And it seems that many of the clinicians are frustrated by the payer system.
Yeah, and I think there's a lot of areas that need to be addressed. And I think what we're finding with the states is the state societies can really act as that vehicle for clinicians in the state to have their voice be heard. And so we're also partnering in many of our states with the American Cancer Society Cancer Action Network and other advocacy organizations to really bring in the voice of the patient as well, because that's an important aspect of this. I mean, if, the reimbursement issues, copay accumulators have come up as an issue in many of our states, and they're impacting patient care.
Yeah, no. Do you have anything else you'd like to add?
No, I just think if anyone wants more information on any of the states that ACCC manages, you can go to Oncology State Societies at ACCC, and you can look at the states that we manage. And then also any of the other state affiliates are also on the ASCO website. So if you want information about a state society within your own state, go to the ASCO website or the ACCC website.
And we should also encourage all clinicians to join their state society,
and to be part of their state society. Absolutely.
Thanks.
Thank you.
Thank you for listening to this podcast recorded live at the 2022 Asco Annual Meeting by Oncology Data Advisor and Convey Med. For more expert perspectives on the latest in cancer research and treatment, be sure to subscribe to the podcast at conveymed.io and oncdata.com. Don't forget to follow us on social media for news, exclusive interviews, and more.